Hi, my name is Lauren Carmichael, and in this video, we will be discussing the different types of personality disorders. What are personality disorders? Personality disorders are a type of mental illness. They have long-term patterns of thoughts and behaviors that are very unhealthy. These disorders can cause disruptions in personal lives and professional ones. People who suffer from these disorders have a lot of trouble dealing with everyday stress and problems. People who have personality disorders normally have rocky relationships with others. The cause of these is unknown, but genetics and experiences may play a role. There are several different types of personality disorders, and the symptoms of each are different. They can also be mild or severe. So how are personality disorders grouped? They're grouped into clusters, which are categorized by different characteristics and symptoms. Many people who have one personality disorder also have symptoms and signs of at least one additional personality disorder. So they kind of go hand in hand. You usually don't find one by itself. People who have them usually have one or two at the same time. What kind of treatments are used for personality disorders? There's not a set medication specifically used to treat personality disorders. Antidepressants, anti-anxiety medications, or mood-stabilizing medicines can be helpful in treating some symptoms. Cluster A is the first type of personality disorder we will discuss. Some characteristics of Cluster A disorders are that they are odd, bizarre, and eccentric. Paranoid personality disorder. People with PPD suffer from paranoia. They are also very mistrustful and suspicious of others. This disorder usually begins in early adulthood and appears more common in men than in women. People with this disorder are also very unforgiving and they hold grudges. They are hypersensitive and take criticism poorly. They have recurrent suspicions without research that their significant others are being unfaithful, and they have difficulty relaxing and are hostile. So while treatments for PPD are in process, cognitive analytic therapy has been proven to work for one particular patient. Researchers treated a patient with PPD and used CAT for 24 sessions to do so. After these sessions, quantitative results showed that 5 out of the 6 daily rated paranoia target complaint measures were extinguished during treatment. From Kellett and Hardy, 2013. The next disorder is schizoid personality disorder. Schizoid personality disorder is a pattern of indifference to social relationships with a limited range of emotional expression and experience. People who suffer from this disorder don't think that there's anything wrong with them, but it also prevents them from having close relationship with others. They are very in touch with reality, but they thrive in work environments by themselves. They are indifferent to praise or criticism, and they rarely take pleasure in any activities. Treatments include psychotherapy. Next, I have a video of a girl from YouTube who actually has schizoid personality disorder, and she explains a little bit about the disorder and what it's like to have it.
Kind of the thing that I would really say schizoid is like looking at the world from the outside of the world. It's looking at something from a third person point of view. It's kind of like a black and white out of it kind of viewpoint. It's hard to explain. I think anybody that suffers from schizoid would kind of understand what I'm talking about. It's kind of feeling like you're just going through the motions and you don't fit in, so you don't try, in a sense.
Schizotypal personality disorder. People with this disorder suffer from an ingrained pattern of thinking and behavior and have unusual beliefs and fears. They also have difficulty forming and maintaining relationships. This disorder is more frequent in males and usually surfaces in early adulthood. Those with this personality disorder manifest strange beliefs such as witchcraft and aliens. They are uncomfortable in social situations, they have difficulty making and keeping friendships, and they also have an inappropriate display of feelings. When it comes to treating SPD, one researcher took it upon himself to try and find the best treatment. He argues that the modern structural theory is the most effective way to understand and treat individuals with SPD. Ridenour, 2014. The next cluster we're going to talk about is Cluster B. Some characteristics of the disorders in Cluster B is that they cause very dramatic and erratic actions. Antisocial personality disorder. People who have antisocial personality disorder consistently disregard and violate the rights of others around them. They lack a stability in job and home life. They are normally very irritable and aggressive, show a lack of remorse, are very deceitful, and have had a childhood diagnosis of conduct disorder. It's very important that they had a childhood diagnosis of conduct disorder or they showed actions, because you must have done that to have been diagnosed with antisocial personality disorder. While there's a 3-to-1 ratio of men versus women with ASPD, research on this is scarce. Researchers Alguria et al. Set out to find the differences between sex in childhood and adult adverse events. They discovered that while men are more likely to suffer from ASPD, women have higher rates of aggressiveness and irritability. Jeffrey Dahmer and Ted Bundy have both been diagnosed with this disorder. Borderline personality disorder. Borderline personality disorder affects mood stability, difficulty with interpersonal relationships, and high rates of self-injury and suicidal behavior. People with BPD often have instability with family, work life, long-term planning, and their sense of identity. They also have high rates of self-injurious behavior, such as cutting, and higher rates of attempted and completed suicide. The cause is unknown, but societal and genetic factors play a role. The recommended treatment includes psychotherapy, medication, and support. Coming up next, I have a video of a girl who is in the middle of a BPD episode, and she voiceovers and explains what's happening to her in this clip.
This BPD episode was interesting. It was triggered by a slew of things, primarily the loss of somebody important in my life. It was a dread of loneliness. It was a missing of a past life. I felt torn up, distorted, ugly, useless, disgusting. I felt completely outside my body and yet swallowed up by it at the same time. My brain during an episode of BPD is like a stabbing. It's like tiny little needles that won't stop poking me when I'm just begging them to. It is like every nasty thought I have about myself comes to fruition, only it isn't really. Like in reality, I'm perfectly healthy. I'm totally fine. But inside of my brain, I am a complete worthless person. This is temporary. This is not real. This is my brain not being able to process negative emotion because of past trauma. This is the BPD flaring up, and this is my chance to utilize tools to make myself feel better. One of the ways that I battle BPD is kind of crying it out. One of the most important ways, though, is to listen to things that put me in a better headspace. During this episode, I decided to listen to music, specifically
Histrionic personality disorder. People with histrionic personality disorder are usually known as the life of the party. They believe that their personal relationships are more intimate than they usually are. They do well in jobs that require creativity, but have difficulty with tasks that demand any logical or analytical thinking. They are self-centered and feel uncomfortable when they are not the center of attention. They are overly concerned with their physical appearance and use it to draw attention to themselves. Narcissistic personality disorder. People with narcissistic personality disorder are frequently described as arrogant, self-centered, manipulative, and demanding. People with NPD claim that they are unique or gifted and they seek admiration and attention. They have difficulty tolerating criticism or defeat, and they also like empathy. Treatment is very challenging because the people with this condition don't like to acknowledge problems and vulnerabilities, but psychotherapy can be useful. The last cluster I'm going to discuss is Cluster C. Some characteristics of the disorders in Cluster C involve anxious and fearful behavior. Avoidant personality disorder. People with avoidant personality disorder suffer from extreme shyness and a fear of rejection. They are easily hurt by criticism or disapproval. They don't have many close friends, and they are very reluctant to become involved with others. The cause is unknown, but rejection by parents could play a role in the development of this condition. Psychotherapy and antidepressant medication can be used to help treat those with this disorder. Dependent personality disorder. Dependent personality disorder is almost the exact opposite of avoidant personality disorder. People with this disorder have difficulty making everyday decisions without excessive advice and reassurance from others. They need others to assume responsibility for most major areas of their life. They don't like to disagree with others because they're scared of losing support or approval. They don't like to be out of a relationship because it's a source of care. Treatment requires long-term therapy and medication. Obsessive compulsive personality disorder. While OCPD is similar to OCD in name, they are two very different conditions. People with OCPD think that their way of doing things is the right way, and they have to follow set procedures or routines in their daily life. For someone with OCPD, everything is about rules and a need for order. They are preoccupied with perfectionism, but this tends to make them harder to work with or be around. Treatment involves psychotherapy, medication, and mindfulness techniques. Next, I have a video of a young male who has OCPD, and he describes how it affects him and how it affects his daily life and his need to be perfect and his need to have everything done the right way.
People are hardworking, but their obsession with perfection makes them inefficient. And I can't stress how real that is for me, because I have so much ambition in me and so many things I want to accomplish, but sometimes it gets slowed down because I'm too busy trying to force everything around me and myself to be perfect. So it just becomes a struggle. But yeah, and especially with me wanting to pursue acting and get myself out there, it's sometimes hard because it's some things with acting you have no control over, and it almost makes me feel a little intimidated. But I have to tell myself that I won't always be able to control everything, and that new things shouldn't be scary. You just have to get used to them. But yeah, so even though I do get some things done and I do put myself out there, I could be doing like 50% better. You know, that's okay. I know I'm struggling. At least I've addressed the issue.
For our last disorder, it's going to be a different kind of personality disorder. Dissociative identity disorder. Dissociative identity disorder used to be known as multiple personality disorder, which is why I wanted to include it in this presentation. People with DID develop one or more alternate personalities that function without awareness of their usual personality. While there isn't a set cause, 90% of DID cases involve history of abuse. When the alternate personality, or alter, takes place of the core personality, amnesia is likely to have taken place. An alter could be of a different gender, have a different name, and act completely different. Dialectical behavioral therapy has been shown to be effective for people with borderline personality disorder, and it has been adopted to help people with DID and has actually been proven to work. In this next clip, it's from the TV show Bates Motel, where Norman, who has DID, is talking with his therapist, and you can see his other personality or his other alter mother try and interrupt their conversation.
He was an alcoholic?
Well, not officially. He didn't think he was.
But he drank a lot.
Don't talk about it, Norman.
Why are you here?
I don't want you thinking about this or talking about
I
it.
have to, Mother. You can't be here.
I have to be here. You're not listening to me.
Is she here, Norman?
She doesn't want me to talk to you.
Can I talk to her?
I'm right here. Just leave him alone. If you want to ask him something, ask me.
Why don't you want him to talk for himself?
Because there's things that have happened. Things that he does not need to remember. And I have worked very hard to make him forget about these things, and I don't need you undoing it.
I think it might help him.
I was there. It won't help him. It will crush him. Don't blame me. It's not my fault.